Hi, I'm Marty Agather, Embrace Prevention Care. Thanks for joining us for this episode of Preventive Care Now for older adults. In this series, we focus on what we call the geriatric determinants of health. These include chronic disease care, medication adherence, medically directed wellness, geriatric care principles, and patient psychology. All of these contribute to keeping older adults healthy, in their homes, and doing what matters most to them. I've said my piece, so let's get on with it.
The rural mortality rate is actually 18% higher than large metropolitan areas. So it's a pretty significant gap. And that compares to 20 years ago. The gap was only, the rural mortality rate was 4% higher and 5% higher than the large metro areas. So this gap is growing as we go forward. Now the good news is that the mortality rates have declined, for all the populations. They've over the past 20 years, it's declined by 16% for those in the rural areas, but it's declined by 25% for those in the metropolitan areas. So, we are, the care. Things are getting better. However, they aren't getting better as fast in the rural communities as they are in the more urban communities. And in our focus with Embrace Prevention Care, we really focus on how do we reduce preventable hospitalizations. And there's another study that's in the show notes. This is done by the HCUP. This is part of HHS, and they publish the percentage of preventable hospitalizations. And so one of the things that we see there in terms of the difference between rural and urban communities, the rate of rural preventable hospitalizations is the highest of any location. It's 20% higher than the average, and it's 34% higher than the lowest location, which is described as medium metropolitan. So again, these are pretty big differences in terms of the ability to provide the type of care that's going to prevent these hospitalizations from occurring. And so, it's sort of with that backdrop of data that we wanted to really sort of have a three-part discussion this afternoon. One is to get people's ideas on why this is happening. What have you seen? What do you know? What are your ideas in terms of why we see this gap occurring? And then the second part then is to really talk about some of the things that we may have seen that are being done differently to try to address this problem. And then, the third is just sort of summing up some of the key points that were brought to the stage by all of you. So that's sort of the agenda for this afternoon. I've been talking long enough. We have a number of people up here on stage, and so I'll ask them to provide their ideas on what's happening with the rural health lagging behind the urban. So, Debbie, would you like to share some of your thoughts on this with us?
Yeah, hi, thank you. Well, in listening to you speak and giving these statistics, my mind was going to the why and not necessarily even looking at it from a policy standpoint, but rather the people themselves. And you did say that, I think you said that more of them live with families. So I thought, okay, the community part is there. So it just makes me wonder about access to services, the preventative services, the education about food and diet and lifestyle. And so that's all I have to say so far, was just that where my mind was going when you were giving these statistics as to the why before we get to policies in hospitals or care there. I was trying to think about the life or the health of the people before they even enter the system. I'm done speaking for now.
Great, thank you, Debbie. I think, yeah, that's exactly what we want to sort of explore now is those whys. And again, I was surprised at the the fact that in the rural communities there are more people living with others, less fewer people in skilled nursing facilities. And as you said, that suggests that there is more a family community to support the older adults. And what that brings to my mind is that we may be missing out a lot on the caregiver opportunity to be able to help with prevention in terms of involving caregivers more to be able to both monitor and help patients take the right actions. I know that that's an area where since we have more people living with our older adults in rural areas, that perhaps that's an area of focus. So, Liz, you've up on stage here. Uh, could you share some of your thoughts with us, please?
Sure. I'm Liz. I'm with Get Set Up. We have a virtual online learning platform for older adults. So I was just thinking what you were saying was really interesting. We found that a lot of our learners do come in from rural areas because they don't have access to some of the health and wellness and some of the classes that talk about diabetes prevention or healthy cooking and things like that. And I think that being able to kind of create these resources and offer them is super important. I was talking with one of our partners, Age Guide, which is an area agency on aging outside the Chicago area. And what they've been doing that I think is really successful, and they're waiting still to test kind of the metrics, but they've been giving away tablets with internet. And they're really trying to get to some of those locations that are more rural because maybe there aren't the senior centers there or there's not access to some of the services. And I think it's going to be really interesting to kind of watch that and see if that's a successful way of working with some of this kind of preventative care in advance. That's all I have to say for now.
Great, thank you, Liz. Yeah, I think the access is so important. Obviously, in rural communities, physical access is usually more of a challenge. Living further away from resources, whether it's senior centers or hospitals or clinics or even their doctors' offices. There are many small towns that that no longer have physicians, and people need to travel quite a ways to get to their doctor. And so, looking at what are the ways that we can provide more access, virtually, I think is one of the things that we really need to work on. So thanks for bringing that forward, Sandra. You always have some interesting perspectives on things. I look forward to your thoughts.
Thank you, Dave. And I do have a question. When I look at preventative care, and we're talking about rural health and those people that live in the rural health area, I noticed that there are like studies that are being done on rural health and how we can best reach those people that live in the rural health area. But when you reach them and you give them tablets or you give them phones and you say, hey, you can use this, or is there any health literacy going on where you're explaining, or not so much you, but where those that live in the rural areas that do not have, a lot of times don't have connections that, such as those that live in the city or some urban areas. Is there any indication that a study has been done on the literacy to make sure that the people that do live in those areas where they are unable to get access to any type of information are being asked, do they understand or being told, well, hey, this is what this is? That's my question. And you probably will be best to answer that, either you or Liz, because you guys actually work in that area. What is actually being done for literacy in those rural areas? This is Sandra, and I pass it back to you or Liz.
Thank you, Sandra. Liz, would you like to comment on that?
Well, I could just talk a little bit. I know I had talked to Dr. Stills at the NCOA, and a lot of their kind of age prevention, healthy aging coursework went virtual, of course, during the pandemic. And so I do think they have been able to track that. I don't have statistics on that. I think that's kind of still in the works. I know a lot of our partners are tracking that, but one of the key aspects is really creating that kind of programming that brings health literacy and brings specific classes and around care and prevention and just making sure that happens. So I do know that that is a forefront for multiple organizations. That's all.
Sandra, actually, I have popcorn news today that's going to, I think, speak a little bit to your question. And of course, the link to that article will be in the show notes. So if you can hang till the bottom of the hour, that's great. If not, just go to the show notes and I'll have something on just announced by Health and Human Services yesterday. Thanks. This is Marty.
Marty, thank you. Yes, I will hang around. If you got something, information for me, I'm going to hang around. It's all about teaching and learning, so I will definitely be here.
That's what it's all about. We want teachers and learners just sharing information. So it's great to hear, Sandra. Doug, thanks for joining us. I know I couldn't remember if you were going to be able to duck in and had to duck out. So would be interested in, you've had a lot of experience with a lot of different health systems, and so perhaps you can share with us a little bit of what you've seen, in the rural areas in terms of what we're exploring is really sort of why is there a gap between rural and urban, and why is it growing? And so I was wondering if perhaps you could share some of your thoughts on that.
Oh, sure. I think what it is, and I've had patients that lived in a rural area. I case managed patients that lived in Hawaii, and I don't think you can get, I mean, not Hawaii, but Alaska. Um, and you can't really get more rural than Alaska. And so, the thing is, I think we've branded a lot of health plans, or even our Medicare in general, or the health health plans we get from the government, Medicare or Medicaid, has branded themselves as more of a reactive type medicine, and you have this insurance card, but you can utilize these insurances as you need them, but not necessarily preventively. The Affordable Care Act expanded on that and expanded the preventive screening to be waived of any copay, and part of your so if you had fee-for-service Medicare and you had 20% copay, your copay is waived. So, but it still didn't get that big uptake of people taking advantage of getting preventive screening services done. And I think as a society, I mean, let me ask everybody here on the panel, has everybody heard of the U.S. Task Force, guidelines for preventive healthcare screening? And it's not something that we really talk about, and it's not really public knowledge. So we have a real health literacy, like I heard somebody saying earlier, that people don't realize that they should be getting these health screenings done periodically to see where they're at, and if you can catch some diseases early on, or even catch some illnesses early on, however you want to word it, you can really improve your health, and by not letting things get worse. So I just feel that we've never campaigned as a country to get people to be more preventive screening orientated. And I'm done speaking.
Doug, is there a link to what you just referred to and asked us all if we'd heard of it so that we can make sure to put that up in the show notes?
Yes, I'll drop a link. United States Task Force of Preventive Treatment and Screening. It's a government agency, and they align the screening protocols all through there with the different recommendations, and it's something that most doctors and nurses are very aware of, but like I said, general public is just not aware of.
Doug, thanks for that. We're actually looking at one of the recommendations from the U.S. Preventive Task Force, that talking about cognition assessments, and it's interesting that they are sort of they neither support them or say don't get them. They say there's not enough information yet, and we want to bring that as a future topic but I wanted to find some experts to be able to address sort of the reasons why, whether it's just we don't have enough good actions that that we know to take when we detect cognitive issues, or what the other issues are, why that these aren't strongly supported by the task force. So, but it is I think it is something that um, probably even a lot of uh, primary care physicians may not be up to date on all the recommendations that the task force provides, and I think that's where, as you mentioned, that we just need to. In some way, be able to bring prevention more to the forefront, so that people can take advantage of the assessments that can be done, and get a jump on their diseases early. So thanks for bringing that up, Doug. And Zalan.
Hey, Dave.
Oh yeah, Jeff, go ahead.
Sorry, it's Jeff Englander, and I apologize for interrupting. Can I just make a quick comment here? So, and I apologize. I just joined. I saw Doug had joined, and I clicked in. So I'm a Doug stalker. But so I'm Jeff Englander. I'm the founder of a firm called the Healthcare Strategy Bullpen. We try to bridge the disconnect between healthcare and technology. And one of the things I'll say is, if it hasn't been said, the USPTF is, I think, the abbreviation, and the USPTF designations or the determinations, that's what the insurance companies, the managed care plans, Medicaid, Medicare go off of when determining whether preventive tests are covered under your insurance. So when you need a physical every year and it was covered, that was covered in the ACA, but it was off of a USPTF determination. Whether you get certain other diagnostic tests and they should be covered 100% under your insurance often falls out of the USPTF. So it's certainly, excuse me, very important to follow what you see there, because that's really going to tell you whether there's basically a fishbowl of patients that might be available to you, who should have these tests, and where they might be effectively not getting treatment that's 100% covered. I'm Jeff, and I'm done speaking.
Jeff, thanks for sharing that. And again, I'll just make a comment. I mean, this is exactly what we're looking for. Is anybody that has as insights on topics that bring up please raise your hand, and we'll get to you real time, so that the conversation flows. And obviously understanding, again, one of our weekly sessions is following the money. And so if the USPTF is really sort of deciding where that money flows, it's good to understand exactly what they're recommending, and how do we, focus on those things, and the things that are not being recommended yet. How do those move through that process to be able to become recommendations? So that's great. Thanks, Jeff. Zalan, glad to see you're able to join us today. Perhaps you have a view on what happens in another country as far as addressing the needs of rural health.
Hi, Dave. Good to see you, Linda and Marty, as always. So, rural communities wise, in the UK, there can be real issues regarding this in terms of accessing healthcare and facilities. Obviously, telemedicine has made a real impact in terms of allowing people to outreach into areas that they couldn't do, and allowing access to specialists in a way that was traditionally quite difficult. The one of the things that you tend to notice now is with the more rural communities, one of the ways that they engage usually is more locally, and often as a doctor, as a GP in a family medical medicine, a doctor um, as a family medicine doctor in a sort of semi-rural part of the UK. I would say that they tend to focus on how they can engage at a local level, and people tend to respond more to the family doctors and the local community services in a more productive way than they do with the hospital. So often we'll have more negotiations with people where they'll say, I don't want to go into that far away when it regards to my care. And I think COVID has had a big impact on this because the restriction on access and visiting times as well. One way around this for us is that we focus more on sort of bringing the hospital closer to home, and those smaller interventions have a bigger impact from my experience. Yeah, so I'm Zalan and I'm done speaking.
So, just a follow-up question there. We know in the U.S. it's getting harder and harder to get physicians to work in rural communities, and as a result, the ones that do work there, tend to be really strapped with a large number of patients, and what we know from the way a physician's office works is it's first about putting out fires, and then maybe we'll get to prevention later. And so as a result, I think a lot of preventive services get shunted to the side just because of the lack of resources at that local level, as you talk about, which are most effective. And so I'm just curious, in the UK, if you see the same kind of reduction or lack of primary care physicians in the local communities, and if they're overburdened there as well.
That's a great question, Dave. So the way the system is designed in the UK is you have several layers. You have the family medicine GP clinics, followed by what they call now primary care networks, which are networks of around up to 20 to 30,000 or even a bit higher, where several clinics integrate together to target and localize services to the needs of the community. So my area has a preponderance of elderly patients. So, for example, the network has then recruited particularly pharmacists to work collaboratively with us to reduce some of the administrative workload and improve medicines reconciliation, as well as decreasing polypharmacy. And we've also recruited sort of paramedics, for example, who would go out and do some of the domiciliary or home visits that we would do, and reducing some of the pressure on us there. So that's one way they've taken and as approach to sort of reduce the fact that, similar to the US, we're struggling with workforce shortages. And in these areas, for example, of inner city or in quite rural areas, the use of sort of alternative sort of allied health professionals to plug some of those gaps has become a big thing. My own feeling is that there's a trend increasingly towards the equivalent of a primary care type consultant role or specialist role, where you have a generalist in the community who focuses on coordination and continuity, but their role becomes a bit more less direct contact and more oversight, sort of similar to what you would expect a senior clinician in the hospital to be. That's my feeling of a general trend to combat this, because obviously you can't oversee multiple different allied health professionals while also running your own clinic. It wouldn't be safe from a governance point of view. I hope that's answered your question, Dave.
Yeah, thank you very much for that perspective. Appreciate that. Jeff, you come up here. I don't know if you had other comments from other than the USPTF that you want to share with us.
Yeah, I just did have two other quick comments, Dave. Thank you. One was on the USPTF. I would say that it pays to engage, and if particularly if you're employed and you get your insurance through your employers, I will say, having worked with large employers and worked with their benefits department, if you think there are other things that people should be getting preventive services for, lob that up to your benefits department, because they do, through their policy departments, try to influence national health policies and do influence people like the USPTF, because they know that if it gets covered by the USPTF, they're going to have to cover that in their benefits. They do keep an eye on that. So that's one thing I'll say. And the other thing I would just say is, in terms of preventive care, encourage people who are looking for preventive care, whether it be if you're an adult child of a parent or others, there are other places sometimes they can go that are easy. For instance, the nurse helplines, to ask about other things that they where they may need to find out, should they be getting additional preventive services, and those are things they can take advantage of. So those would be my two suggestions. I'm Jeff, and I'm done speaking.
Jeff, Marty, Agather, were you referring to these other resources like the nurse helplines? Are you typically talking about that you're accessing those via the insurance provider? I'm Marty, and I'm done.
I'm thinking, yes, of via the insurance provider in terms of like a commercial insurance company, and I'm thinking of an employed individual. But even now, through managed Medicare and managed Medicaid, you're seeing increasingly, people that have that. And I'm even thinking, Marty, not as even outside of preventive care. I don't know how many of had this instance where you have you're an adult child taking care of a parent, and parent goes into a doctor or has minor surgery or something, and they're put on some kind of either painkiller or antibiotic, and it upsets their stomach, and they just stop taking it, as opposed to calling the doctor and saying there's something else I can be put on, and they should just they can call into the helpline and say, look, is there something else I can be put on? And a lot of times they'll be able to suggest something. You can just call into the doctor's office and get a new script. But those are some of the things I'm thinking of. I'm Jeff, and I'm done speaking.
On behalf of Sandra, who I know this is one of her hot topics, is sort of what other resources might there be? Are there centralized resources provided by the government or something where someone can find local services that are low cost or no cost to identify potential preventive services that they could access if they are economically challenged? I'm Marty. I'm done.
I don't. I'm sure there are. What I can do is I could say, Sandra or Marty, if you want to reach out to me. I know, having dealt with Medicaid, typically what I would say is if you look, either within Medicaid or in your state, or even within your local municipality, that typically are. Unfortunately, they're not as easy to find as they should be. And there are often places within even the providers in the hospitals. They are available. As I said, unfortunately, they're not as laid out as well as we'd like at this point, but they're getting better.
Thank you,
I'm
Jeff.
Jeff.
Let me reset the room. So today we're talking about the disparities between rural health and urban health, and why the gap in preventable hospitalizations is increasing with older adults in rural America. And I see that Jonathan's on the stage. We want to get to you immediately following Jonathan, but it's the bottom of the hour, so it's time for our popcorn news item. So what we do in Popcorn News is, if you've got some news that you've seen that's particularly interesting to our group here with preventive health for older adults, we encourage you to bring that to the stage. We go in popcorn fashion, which basically doesn't mean first come, first serve. It's raise your hand and we'll get to you. And I've got an item, but I'm looking for somebody who might have something else to bring. So flash your mic if you've got something. If nobody flashes, I'll bring mine. Thank you. I'm Marty, and I'm done. Well, Jonathan, since you're flashing, go for it.
Thank you for inviting me up to the stage. My name is Jonathan. I am a licensed psychotherapist in residency in Northern Virginia. I actually talked about preventative care for older adults in this room before, but I'll bring it back up again. When I first started my career, I started my career in home health care. in Roanoke, Virginia, which is a predominantly rural, semi-rural area where there are a lot of seniors who are either retiring or aging in place and that kind of thing. And I joined an organization around 2013 to 2014 called Casino Healthcare. And that program, or that organization, had a program called the PACE program, which was a program of all-inclusive care for the elderly, which would be an alternative to a nursing home, which would provide preventative services for older adults as they are aging and aging in place. And it would be for individuals who were either 100% Medicaid or Medicaid and Medicare. They were dual enrollees. And people would enroll into the program and pay for the Medicaid portion of the PACE program at a particular tiered level based on their needs. And we started the PACE program in Roanoke, Virginia, when it was in its early developments. And at that time, people were poo-pooing this particular preventative solution at the time, not really understanding the PACE program, not really getting it. So we had to do a lot of education, a lot of training in the communities. I came on as a public health educator, working with the director of admissions and community relations, as well as the director of marketing, to really try to promote this solution in the community and really get people to understand what PACE was and provide this as an alternative to going into a nursing home, which can be costly. And really didn't get a lot of response, and it was a slow to adopt program, PACE program, but it eventually began to enroll members into it after 6 or 7 months of community engagement and really going out and educating the community about this preventive solution. Fast forward to now, we are in COVID, and now people are in somewhat accepting this PACE model because the PACE model was already set up for to provide wraparound services for seniors and the elderly as they age in place. They're already in their homes and pretty much bringing the nursing home services into their home environment, with providing them with a team that was called an IDT team, interdisciplinary team of, they would have a gerontologist or a physician that works with the elderly population. They had a speech therapist, occupational therapist, home health nurse, social worker, and they're pretty much bringing these services in the home to make sure that the plan member would receive the care and pretty much improve their health outcomes. And so while this solution has been overlooked by policymakers and funders and investors in the past, it made it very difficult for the pioneers of the PACE model to get started. And so now, because of COVID-19 and the demand for home health services and in-network services to provide care for the elderly, this is like an on-demand solution where now it's readily accepted, and people need to get on board with it. But because the model does work, it is effective, and we should definitely do some type of room or have some conversation around the PACE program, because it could be something that we can introduce. So I'll just wrap up and just say that PACE in the past was not readily accepted as a solution, but now with COVID and the infections and the mortality rates increasing, PACE has always been around and will definitely be a solution that we should be talking about more and more as more and more people are aging and dying, and resistant to go into the nursing home and looking for options to age in place. This is Jonathan. I'm done speaking.
Jonathan, thank you very much for bringing up PACE, and I think it is very topical, especially for people that are needing to need more support to be able to to age in place at home and may not have the resources to do it. One of our advisors, our geriatric advisor, geriatrician at Embrace, runs one of the largest PACE programs in the country here in Massachusetts. And we trying to get him scheduled where we will have a session just on PACE because as you mentioned, I think there's a lot of good things to learn there. Another place to go to learn more about PACE, I'll do a shout out to the Jerry Pal podcast. Everybody in this room should check it out. It's GERIPAL. And it's run by a couple of geriatricians out of UC San Francisco. And this is where the PACE program started in the US. It actually was imported, the model was imported from, I believe, the UK. Salon may know more about that, but make sure and and look up the Jerry Powell podcast. They did a great one on PACE, I think a couple months ago, but they always have great opportunities or great podcasts there. So with that, Marty, I'll throw it back to you, and if you want to have your news item, and then we can
Certainly.
see
Thanks,
if anybody else
Dave.
has
All right.
any
So we are in
items.
popcorn news. And I just ran across this that yesterday Health and Human Services announced that they were going to expand support for telehealth to the tune of $19 million to expand telehealth into rural and other underserved communities. The rural initiative is called Telehealth Tech Enabled Learning Program. Unfortunately, it's only $4.25 million at the present time, but the concept is to teach to connect academic hospitals in more urban settings to rural clinicians and support those primary providers via teleservices to give them access to techniques and learning that they don't have access to. So this is to Sandra's point, but also then to connect their patients to specialists and the like. And that link is in our show notes, which is at www.embracepreventioncare.com/show-notes. So if you want to see that link, please go there. Anybody else who has a popcorn news item, please raise your hand, flash your mic, and we'll get to you and we will put your a link. If you can drop that to me, we'll get that in the show notes as well. Thank you so much. I am Marty, and I am finished for now.
Okay, I have one. This is Linda Sherman from nextavenue.org, and it's the news roundup from the 2021 International Alzheimer's Conference. And I'm posting it on my Boomer Tech Talk Twitter so that you can pick it up there. It's just a really nice roundup with links and good catch you up on the latest what's happening with Alzheimer's.
Thanks, Linda. That's great. I didn't see anybody else yet flashing their mic. I'll give you a little bit more time, and in the meantime, I can't avoid talking about COVID-19 and where we are. Again, yesterday, over 150,000 new cases. 23,000 of those in Florida, where we have a huge, older adult population. I was traveling back from vacation and sat next to a guy who was proudly announced that he hadn't been vaccinated, and he was probably sad that he sat next to me, because then I had to let him know all the reasons why he should get vaccinated. But again, just use this time to, I know we all hear a lot about it, but we each need to try to do, whatever we can to help people get vaccinated, and again, start wearing masks, especially indoors. This Delta variant is just, brutal when it comes to transmission, and we need to try to, once again, try to flatten the curve. So it's repetitive news, but it's important for our population. So anybody else have any other popcorn news items? All right, we're going to start making popcorn news items the price of admission, just to get more diversity and more things in here. So bring one for next time. Again, it doesn't have to be something that is just happened this week. something that's relatively recent, pertaining to preventive care for older adults, or more broadly to healthcare overall is also fine if you think it would be interesting for this audience. So we have about 10 minutes left. I wanted to make sure that if we had any other thoughts from people who haven't spoken yet about the gap and increasing gap between uh, the rural healthcare and what we see in the metro areas. Be happy to get your thoughts and share those with the group. Um, and if we don't have any new speakers, I guess what I would like to do then is to, based upon what we've
I have
heard.
a tiny thing, if I
Oh,
may.
sure, go ahead.
Um, I feel like I live in a rural area because I'm on an island with only 60,000 people. Does that qualify on Kauai?
I would think so.
Okay, good. It feels very rural. Sometimes I feel like I'm in a third world country, actually. But at the same time, um, one interesting thing about where I live is that it's very Asian because of the history of Hawaii, and people are very good at taking care of their elders in their families, and they have managed to give us a really good health system here. We're very fortunate in that it's a very attractive place to be, especially if you like to surf. So we get a lot of surfer doctors. So, but we only have 7 ICU beds. So we do. Thank you very much for reminding your seatmate, Dave, because we really have to worry about the visitors coming in, and would certainly want to get everybody vaccinated. And that is one thing about any small area and with small hospitals, that we really have to be extra careful because we have so little capacity. But I think that in general they've done a good job because the state has connected a chain of hospitals in the same chain across the islands, and even though they're smaller as you go across, they're doing a pretty good job. So, and Hawaii has always been a, a far ahead in terms of providing preventive care, and kind of more like Massachusetts in moving towards national health as a state. And so it's good to look at the examples of where people are able to do well and still be rural.
Thanks, Linda. Um, yeah, I think we need to look at where there are successes and sort of understand in rural communities that are bucking the trend, and I think this topic will be something I'd like to revisit sometime in the future. And again, I think what we'll try to do is to when we take deeper dives on some of these things, try to get some experts in the area to be able to provide their view on it, and take us sort of a next level down in terms of our understanding of some of these issues. And so what I'd like to do is as we approach the top of the hour here, is to ask people that are on the stage now, if you have just maybe some of your thoughts and about what you've heard today, and sort of action items that either you're looking at in your positions to be able to pursue, or things that you think other people should take forward in trying to close this gap. And while you're thinking about those, I'll just mention that we'll in our cycle next week we'll be back to following the money, and that I wish I could say I had the topic, or that we had the topic already already picked, but we don't. We talked about we need to get a couple weeks ahead so we can invite. Let people know a week in advance, and also invite some good speakers to join us. So we're working on that. We'll hopefully next week we'll be able to talk about exactly what the topic will be on the following week, because we feel that will allow our regular listeners to invite other people that that may be able to contribute. So with that, again, anyone on stage that has some sort of summary thoughts about the topic today that they'd like to share with the group?
This is Sandra, and my summary thoughts in reference to today's topic is that we really do have to keep, and when I say we, I mean those of us that are able to be healthcare heroes for those older adults who live in the rural areas as well as live elsewhere in the country. We really have to keep an eye out and keep encouraging them and keep educating them on exactly what preventative care is and where they can go to receive the preventative care services that they do need. Because the issue a lot of times is that older adults and some younger adults have no idea what preventative care is. They just think they can go to the doctor and say, I'm going in for a physical, and that's preventative care. But there's so much more to preventative care. So we each as healthcare heroes have to take a stronger stand and making sure that we're educating those who we come in contact with to understand what preventative care is so that they do get those services. This is Sandra, and I'm complete.
Sandra, thanks so much for that. And I love that term, healthcare heroes, because anybody, can be a healthcare hero, and there's a great opportunity there. Millicent, welcome to the stage, and please share your thoughts.
Thank you very much. My name is Millicent. I'm a board certified adult geriatric. Take care of geriatric patients. I do house call. We go to their homes and I treat them there. I just want to talk about falls and as a preventative, how we can prevent falls. We need to just educate and supervise and check our seniors. We can prevent these falls by checking if there are rags or including plus checking the medication they are taking. We need to really find out, are they taking more narcotics, and that is sedating them to make them vulnerable, to make them fall. Because when I see patients, when they fall, the prognosis is poor. So, and these are some things that we can actually prevent. I also want to talk about COVID. What are we telling our children? Parents, we need to stand up. We need to empower our children. We need to do the talk. We need to educate them, because we have a lot of misinformation out there. So as a parent, do your part, educate your child, and so that if they meet any misconceptions out there, then they already know that you did your part as a parent. Thank you so much for listening.
Millicent, thank you for your comments, and yeah, I think that the things that you're doing are fantastic, and at some point in the future, I hope we would like to do a session on fall prevention, because I think that is a very important one, and so perhaps we could connect offline, and perhaps you could participate in that session when we do that. So. Anyone else have any closing thoughts? Debbie?
Yeah, hi, Dave. Well, that's actually what I specialize in. I'm a yoga therapist and a certified health coach. I taught yoga for osteoporosis. I'm certified through Dr. Lauren Fishman, who actually has a ongoing study that's proven an increase in bone density. So I guess there is some evidence-based research that maybe I could apply through the USPSTF. That's something I learned today. And when it comes to fall prevention, I think that is such a key. And so the services that I offer it's really hard to get that into something like this US preventative services. And the term preventative medicine or preventative services, what's the criteria there that would establish that what I'm offering is preventative services? So I think that that's what really needs to be developed. When I was reading through applying here, because ironically, they have a screening for osteoporosis to prevent fractures. There's an open plan right now on this website that you just gave us from August 12th to September 8th. And it does say, though, that when you apply, to make sure that you write it in the terminology that it's going to be scientists and doctors that are reading this. So it has to be in those terms. So I would say that that's where there's a lot of opportunity, is for the functional health coaches, the yoga therapists that have preventative services to offer for this whole mind-body medicine aspect of preventative health care. That is what we really need to figure out. How do we get the hand to talk to the foot, or get the terminology to be correct, so someone like me could present something that has so much value, yet how do I get it into the terminology it needs to be for policyholders, for medical insurance companies? So that's what I'd like to say, and I'm done speaking.
Debbie, thank you very much for that. And so I think that Debbie and Millicent, if you're willing, 4 weeks from now, when we do our next follow the science, follow the evidence, is let's focus on fall prevention, and have you both up on stage as people that are engaged in this on a regular basis, and we'll take a deep dive into that. Yeah, thank you, everyone. This was a great discussion. We continue to to get more people into this clubhouse, which allows us to to share our learning and get new ideas. So please invite other people that you think might be interested to this room. It makes it more powerful, and makes it more of a chance that we can all be healthcare heroes, as Sandra said. So thanks again. Good luck in being a healthcare hero during the coming week till we talk again. And we'll close in 5, 4, 3, 2, 1. Thank you very much. Have a great week, everybody.
Thanks for joining us for this episode of Preventive Care Now for older adults. Browse show notes to find other episodes, check our calendar to see upcoming dates and times, and join us on Clubhouse if you can. We'd love to hear your thoughts and opinions. Peace.